Doctors, medical examiners, and coroners, what was the weirdest cause of death you have ever seen? My former employer was a coroner in Nebraska, and he had a few crazy stories. A guy was found dead in his laundry room. A glass bottle was taped to the agitator on the washing machine. It broke when the guy attempted to pleasure himself by sitting on it. End result? All his guts were in the washtub. There were also lots of stories where guys are kicked to death and found with their pants off in the stables. Lastly, don't use any farm equipment when you're drunk. It never ends well. I shadowed a medical examiner several times, but the weirdest thing I ever saw still kind of haunts me. There was a woman who died suddenly and had all these bruises on her body. There were detectives and cops all around us because they thought it was a case of domestic violence. However, she was schizophrenic and was not on any meds. During one of her episodes, she would beat herself violently and self-inflict all of these bruises and wounds on her. But the way she died was crazy. She beat herself so much that the bruises developed into huge blood clots and broke off into the bloodstream. They eventually ended up in her lungs and caused a pulmonary embolism. We opened up her lungs and they were just full of blood clots. Her legs were full of them too. She basically beat herself so much that she suffocated. It was so odd. I've seen quite a bit when I worked for the county medical examiner while I was in school. A man went to hang himself. When he jumped off of his apartment balcony, he left so much slack that it took his head off. His head was on a neighbor's balcony and his body was on the ground. When we were there, we couldn't find the head, so we had to knock on a couple doors where the rope was hanging to find it. Another man shot himself in the head with a shotgun in his bedroom and left the ceiling fan on. You know the saying, "Shit hit the fan"? Well, imagine his brain matter hitting the fan. He basically repainted his walls with an interesting splatter pattern of brain matter, blood, and pieces of his face. I tried to clean up as much as I could for his family, although I'm not required to do any cleaning of the scene. But sometimes I just feel bad for people. Anyway, don't shoot yourself in the head until you turn off your fan, please. I worked briefly as a morgue assistant a few years back. The job mainly consisted of moving corpses and holding organs while the pathologist did his thing. By far, the most shocking death I saw was a factory worker who was getting himself off by rubbing his on the underside of the high-speed conveyor belt he was meant to be operating. He got caught, and it tore off most of his crotch. It was ruled as death by misadventure. This was in the UK. He had bled out from his torn femoral artery before the paramedics even made it to the scene. I worked in the county coroner's office for a while. We got a call and I got to tag along. The call was for a body in a barn, face down in a 55-gallon drum. When we got to the scene, the body was bloated and covered in shit and smelled worse than any other corpse I or the veteran coroner had ever smelled. This was the middle of August, so decomposition had moved along pretty quickly. The cops had found a camcorder on a tripod nearby and thought this may be some kind of gang killing. We watched the tape, and it turns out the victim had a scat fetish and had been defecating into the drum for quite some time. He would open the lid, lean over the edge, and jack off. The cause of death was heart attack/drowning. He was jerking it, went into cardiac arrest, fell into the drum, and drowned in a vat of liquid shit. I had a class in med school where the professor would show us pictures of dead bodies, and the class had to guess what happened. When we guess correctly, we move on to the next photo with more detail. At the end of the slideshow, we'd know everything about the deceased and move on to the next case. A lady with a condom stuck in her throat took us the longest. Apparently, she was blowing a guy, and when he finished, she inhaled for breath and the condom got into her throat. The sad part was the guy left her to die instead of calling for help. My mom was a medical examiner for years, and she has a handful of interesting stories. As a kid, I grew up on pictures of dead people, and she would sometimes ask me to go over her reports to verify that her point was getting across. Because if a 14-year-old can understand it, so can a 40-year-old, right? Anyway, I remember two specific instances that brought horror to my young brain and sheer joy to hers. A dude ended his life by suffocating himself on his wife's panties. The other was a motorcyclist who accidentally ramped himself into some woods. His head was twisted around all demon-like. What my mom was so excited to show me was his legs, because it was a 1 in a million case. Apparently, the guy had gone spread eagle and perfectly struck 2 trees on each side of him, basically snapping off his legs. My mom was so excited. "Isn't that cool?" she exclaimed. I remember it vividly. My wife is a pathologist's assistant, and during her schooling carried out the autopsy of a newborn that died minutes after birth. The mother was desperate for a child and had a history of multiple miscarriages at different terms. This was her first time making it full term, and all prenatal checkups revealed no problems. The delivery was difficult but successful, and the baby was alive for a short time. Skip to autopsy. All signs point to the baby being fully developed. She gets to the abdominal cavity and sees the liver is lacerated. There's hemorrhage everywhere. Apparently, during the difficult delivery, the resident used too much force with the forceps to pull the baby out. The ruptured liver caused the baby to bleed out internally. My wife was enthusiastic about autopsy up to this point. Now she has no interest. My friend was a coroner's assistant. He spent a few months there. He said his craziest experience was when a man came in apparently expired. He was a little vague about how the guy ended up on his table, but I'll chalk it up to him still being an amateur. He starts to do a standard Y incision on the torso when he notices that the guy still has slightly active vitals. He looks at the mortician present and says, "Oh, this guy's alive." They determined the best way to resuscitate him was to do an adrenaline shot. Apparently, the man was declared dead, but had something akin to pufferfish poisoning induced in his body. Anyway, the guy comes to and starts screaming like a maniac with his chest partially sliced open. My friend described the whole thing as surreal. My girlfriend was a mortician, and she told me this story. An elderly woman with schizophrenia came in after managing to swallow her severed right arm, from the elbow down, and getting halfway through swallowing the other severed arm, again elbow down, before dying of blood loss. These injuries were self-inflicted and there were no power tools in the room. At the time of the examination, the first arm had already been partially digested. She managed to chew through her arms and jammed them down her throat before she bled out. It was considered a suicide due to her mental state and her deadlocked apartment. If I hadn't seen the look on my girlfriend's face, I honestly wouldn't have believed it. The first autopsy I watched as a medical student was of an elderly lady who had varicose veins. She was feeding her chickens and brushed past a jagged bit of wire fencing, which punctured one of her varicose veins in her leg. She ended up bleeding out because it was venous circulation. If she had laid on the ground and put her leg up, she probably would have survived. I'm not a medical examiner, but I work in the medical field, so I have heard firsthand of some bizarre causes of death. A woman accidentally inhaled a bee, and it stung the inside of her lung. Apparently, she was allergic. It took a week to figure it out. Another interesting cause of death was gunshot to the chest and was ruled a homicide, except the person had been shot 3 decades earlier. A small piece of shrapnel from the bullet wasn't removed when he was shot, and he was completely fine for 30 years. Eventually, the shrapnel found its way into his circulatory system, made its way into the man's right ventricle, and caused a heart attack. If I remember correctly, the man who had shot him was sent to prison for a few years and released, but was rearrested and charged with murder. Another weird one was a man with a fetish of putting a live eel up his ass. It tore a hole through his large intestine. He died. I'm not a medical examiner, but I worked as an autopsy tech to help pay for mortuary school. This has always stayed with me. A 13-year-old girl and her mother had been killed in a car accident. As standard procedure, I was removing the girl's clothes and processing the body when I noticed a bulge in her underwear. When the underwear was removed, her unborn baby was half out of her, between her legs. We were like, what the f***? The last thing I expected from a 13-year-old was a baby sticking out of her crotch. Later in the autopsy, it was determined that her seatbelt was positioned too high, and at impact, the force upon the abdomen expelled the baby. Her underwear and pants kept the baby from being fully expelled. I worked at a medical examiner's office for a summer. A middle-aged Japanese man with lots of tattoos was on the slab. His throat was cut ear to ear, and he was nearly decapitated. I won't get into the fact pattern, as you guys could probably track down the case. Then we looked down at his junk, and there were 7 or 8 little bumps, about half the size of an M&M, randomly all around it. The medical examiner curiously makes a little incision on one of the bumps, and out pops a little plastic bead. I went and did some research, and it appears that genital beating is a Yakuza prison tradition representing every year spent in jail. This is a secondhand experience of something my cousin Steve went through a few years ago. It's the weirdest thing I've ever heard, and it's worth a listen. My cousin and his best bud from med school wound up at the same hospital. Steve became a proctologist, and his friend became a pathologist. One morning, Steve gets a call from a patient he had an appointment with later that day. The patient asks the secretary if he could come in early as his issue was getting far worse. When asked what was wrong, he refused to explain and demanded to speak with my cousin directly. Now, my cousin has terrific bedside manners, the best I have ever seen. He makes it a point to speak with his patients whenever they need to. So he gets on the phone with this guy, and the guy starts pleading with him. My cousin had an opening that morning and told the patient to come in during that time. The patient comes in and is sitting in the exam room. My cousin walks into the room and asks him what's wrong. The patient proceeds to strip fully nude, gets on all fours on the exam table, and sticks his butt out at my cousin. The guy began to explain how his a-hole keeps leaking shit and that it hurts really bad. Except, my cousin immediately saw that it wasn't leaking shit at all. The guy was leaking half of his goddamn intestines. A half-foot of intestine was protruding from this guy's anus and would throb and pulsate with every breath that the patient took. At this point, I wish I could say my cousin got the guy the help he needed. But before my cousin could do anything, the guy screamed, "Just get this shit out of me, man! Get it out!" As he reached behind himself and yanked his intestines so hard that his a-hole erupted with a fountain of blood, coating both the nurse and my cousin. That was apparently the most inhuman scream that Steve had ever heard. The guy was in so much pain after yanking his intestines out that he passed out and fell off of the exam table, smashed his head on the corner of a chair, and died instantly. Enter Steve's friend, the pathologist. He performed an autopsy and found an unraveled slinky string throughout the patient's digestive tract. Apparently, the guy took a slinky and ate it while straightening the metal out. All in all, it makes me shake in anxiety just thinking about the whole thing. I run a forensic science summer program for high school students, and we take them on field trips, one of them being a forensic medical center. The medical examiner there said that he once had a body come in without a head. The man was decapitated, and his body was then dumped in the river. The kicker, though, is that the killer was the victim's boyfriend. His boyfriend was found to be in possession of the dead guy's head. The head had traces of semen in it. The stomach contents did not. I did an internship at the office of the chief medical examiner. A guy took his life in a river by wearing a backpack of rocks. He was found soon and didn't have much bloating due to the submersion. Upon examination, he had a lung infection where his right lung had disintegrated into green liquid. We removed 1.5 liters of green fluid from his chest cavity. His left lung was fine. It was determined after looking at his medical records that he had been to the doctors 5 times before he ended his life, and that this infection had been going on for almost a year until it got really bad. Numerous doctors had overlooked it. Those who knew him suspected that he killed himself to stop the pain. I worked in pathology for 30 years. I've seen it all. I did an autopsy on a hiker partially eaten by a grizzly. Then, I did the autopsy on the grizzly suspected of eating said hiker and found tissue and clothing belonging to the hiker. Yes, I have weird dreams. A welder dropped dead while working on a ship. It was determined that while he was working down in the piss-filled bilge, the metal he was welding onto the ship made molten droplets that fell into some of the liquid around his feet and caused a high enough ammonia concentration to kill him. This was determined by a lab partner of mine who collected her own urine samples and dropped an inch of red-hot heated rebar into those urine samples in Erlenmeyer flasks. Then, she measured the ammonia levels via pH meter in the atmosphere above the P. The welder died from urine. The weirdest case we had was a guy who committed suicide. It wasn't hard to figure that out, but the weird part was that he and his friends were having some sort of suicide race. Like, who could kill themselves first? This kid, who was 21, I believe, had overdosed on a mix of heroin, alcohol, and some other stuff. That was his 3rd attempt that week. Then we realized that our pedestrian versus train from a week before was one of the friends in this pact. By the way, Please don't commit suicide by train. It's really messy and we have to walk a half-mile of tracks to make sure we found all of you. Plus, you're forcing the conductor to kill you. But the thing that made me mad was that this guy knew he was going to die, yet he wore 3 pairs of pants. I was in charge of undressing the body. We're not supposed to cut the clothes off in case the family wanted them or something. Undressing a body that's already in rigor is hard. He had a pair of jeans, then a pair of Superman pajama pants. Underneath those, a pair of Charlie Brown Christmas boxers, in February. I swear he did it just to piss off a morgue worker, who happened to be me. Another weird one was a guy who committed vehicular suicide by slamming into the Jersey wall on the highway. The car stopped, his body stopped, but his heart kept going. It completely transected and fell into his thoracic cavity. Then the car burst into flames. His body was completely blackened to a charcoal-like state. His brain looked like a hard-boiled egg, and his blood coagulated into blood jello. It was very messy, all because his girlfriend dumped him. My friend is an autopsy tech. Apparently, it's not uncommon for cats or small dogs to eat the hands and face off a dead or incapacitated owner. His worst story was an elderly woman who was paralyzed by a stroke. She was still alive when her little dog started eating all her exposed skin before she was found. He did her autopsy after she died. My friend was an undertaker at a funeral home sometime in the late 70s to early 80s. This was when they were in charge of collecting bodies directly from the scene. Someone driving on a country road in Oklahoma noticed a car out in the field, and a young girl, about 16 or 17, crying and screaming hysterically. The car was a T-top Firebird or some other convertible. There was a headless body in the driver's seat. The head was in the back seat, along with another boy who had been split in half at the abdomen. The girl was hysterical, so they couldn't figure out what the hell had taken place here. Apparently, the driver had been sticking his head out of the top of the car, and the other boy was almost sitting up out of the open T-top. They lost control and went off the road through a barbed wire fence. 1 or 2 of the wires went up over the top of the car and cleanly severed the driver's head and the boy passenger in half. My friend said it took them the better part of an hour to determine what had happened. Then he collected up the pieces and went on with his day. I had a male patient die from endometrial cancer. He had an organ transplant prior, and the woman who gave the transplant had metastatic cancer that had spread to the said organ unknowingly. The man survived the transplant, but cancer cells from the transplanted organ populated, and he ended up dying from her cancer. A man fell into a septic tank and died because of suffocation rather than drowning. He was found after 3 days. That was one autopsy my staff let me skip, as I started to retch the moment I opened the door to the autopsy suite, despite wearing an airtight mask. When my parents were in medical school, they attended an autopsy of a patient who had died in a car accident. The autopsy revealed that this guy had survived a chest shot in Vietnam decades ago that the surgeons left in, rather than perform risky surgery. However, the accident had migrated the bullet to his heart and was ruled the cause of death. I worked at a funeral home for a few years. The first ever house call I took was to pick up a guy who died at home. According to his son, this man hadn't seen a doctor in 20 years. We take him to the medical examiner and discover he had a hernia on his scrotum, causing it to be the size of a football. I'm not sure how he lived with that thing, but he was wearing jeans and a jock strap to keep it in. His toenails looked like dragon toenails, as he obviously couldn't bend over to clip them. You know it's screwed up when the medical examiner calls another medical examiner on duty to say, "Hey dude, come check this out." Thank you for watching, and please subscribe to my channel for more Reddit stories. See you in the next video.